Hello, this is Dr. Tom Groover from Boulder Chiropractic Clinic. This is a profile of Boulder Chiropractic Clinic for patients, prospective patients, students of chiropractic, and doctors of chiropractic. We are devoted to facilitating the systemic changes needed to correct, stabilize, and heal our patients' conditions, for them to be well and to develop and live their full potential. For this purpose, our chiropractic is comprehensive in philosophy, diagnosis, and treatment. In principle, comprehensive chiropractic is inclusive and extensive. Its scope is multidimensional, expansive, and at the same time detailed. It's about systems analysis and creating systemic changes as the basis for symptoms relief, stabilization, and healing of conditions. Our clinic is founded upon some fundamental core principles. We have our own standards for what is normal and what is abnormal. We diagnose abnormalities and we restore normality as the basis for healing. It's an inside-out approach. We address primary causes and complications first, and then the rest of the patient's conditions according to priorities. Our paradigm is correction, stabilization, healing, and wellness. We define health as living your full potential physically, mentally, emotionally, and spiritually. We hold that systemic change is necessary for such transformation. And congruency of short and long-term health goals and objectives is essential. This approach of ours is different from the typical symptomatic approach which is practiced in offices throughout the world. So when we say symptomatic approach, we're talking about a patient comes into the office and complains of the neck pain. So the doctor does a workup of the neck and adjusts the neck. And the patient may feel a little better, or they may feel no change. Sometimes they feel worse. They go home, and then when they notice that they want to have another adjustment, either they wonder if more adjusting would help, or if their condition becomes worse, then they go in, they get another adjustment. And this goes on over and over and over again. And the patient experiences oftentimes a short-term improvement, and they experience some incremental change. This is not the systemic kind of change that we're talking about in our way of practicing chiropractic. We begin with diagnosis and treatment of fundamental structural and functional abnormalities which most influence the whole person. These are mechanical, neurological, muscular, postural, organ systems, and there are 4 fundamental subluxation complexes which are involved as the core of mostly everything that we diagnose and treat. The first is the upper cervical subluxation complex, and that complex involves the subluxation of the upper cervical spine. That's the area at the base of where the base of the head relates to the first and second bones in the neck. The occiput and the C1 and C2 atlas and axis vertebra. So at the base of the occiput is a hole called the foramen magnum, and at the back side of C1 and C2 are also holes through which form the neural canal in that upper region of the spine, and the lower brainstem and upper spinal cord pass down through that. And it's a very critical area. The subluxation begins with a mechanical misalignment of all those bones. And when that happens, there's a mechanical problem, which means the wrong kind of movement, the wrong kind of structural support occurs at that level. And that causes wear and tear. Degenerative changes occur in the cartilage, the bone, the ligament, the tendon, the muscle, and the nerve in that region. it leads to pain of the actual structures, but also compressive and tension forces on the spinal nerve roots as they express themselves out from the spinal cord through the openings in the spine in that upper cervical region. So when that happens, then you can have weakness of the neck, and you can have neck and head ache and pain. So that's a local problem that occurs from the mechanical misalignment. But then there are bigger problems. So now locally, what also happens is tension and compression occurs on the neural canal, which influences the cranial nuclei of the cranial nerves in the brainstem region. And those nerves run everything in your head. Your movement of your eyes, the focus of your eyes, the tearing of your eyes, the communication of the visual input signals from the eyeball to the brain, your hearing and equilibrium, your taste, your smell, your touch of your face, movement of your tongue, the opening and closing of your jaw, the shrugging of your shoulders. There's so many local things that can go wrong when the cranial nerves are under this kind of stress. Also, more globally, there's a cranial nerve in the brainstem for the vagus nerve. A cell body for the vagus nerve, which is a nerve that wanders throughout the thorax and abdomen, supplying the organs, all the way to the end of your colon. Also, that vagus nerve is responsible for parasympathetic expression of the parasympathetic nervous system throughout your body. So when that nerve is shut down, then you can have problems with those organs and problems with impaired parasympathetic nervous system, which is a big problem because that's a nervous system that promotes relaxation and sleep and sexuality and sensuality and appreciation for beauty and digestion of food and so on. Also, the parasympathetic nervous system regulates, attenuates the sympathetic nervous system. So when it's impaired, the sympathetic nervous system will easily go out of balance, become too strong, causing adrenal fatigue and wear out, fight or flight response that becomes almost constant, and then problems with digestion of food and autoimmunity and so on. So the global effects become even more expressive when we see what happens with the nerve tracts that are in the brainstem area that control the heart. So one of the problems would be heart blood pressure will go out of regulation. There's the craniocervical junction disorders, which include things like migraine and tension headaches, but also Menieres disease, which is a syndrome of fullness of the ear, loss of hearing, vertigo, dizziness, vertigo, vomiting, nystagmus, the fluttering of the eyes. So we've been successful treating patients with Menieres disease and getting their condition down to almost nothing. So that's a more global influence. There's another influence that we see globally, and that is that the nerve tracts coming down through this upper cervical region, when they're impaired, those nerve tracts will go to every organ and system of the body. Now, the most expressed area that we recognize in our work is the postural distortion, because the nerves which control your anti-gravity muscles, your posture muscles, go out of regulation, and you'll have all these imbalances, these short and long muscles that cause the hips to tilt. So you'll get a high and low hip. You'll get a shifting of your hips off your center of gravity one way or the other. Your upper back can be over to one side or the other. You'll have a physiologic short leg and too much weight on one side of your body when you're standing. So the influence of this postural distortion and the gravitational stress and the movement stress that occurs on all the joints in the body is significant. And it's enough to say that once you have this misalignment, that all your joints are misaligned, all of them are moving abnormally, All of them are undergoing extra wear and tear and chronic degeneration, and eventually will lead to things like whole body arthritis. Also, all these joints are more vulnerable to acute injury. So we have to take care of this big global problem and this local problem associated with the upper cervical subluxation complex. In most cases, first we take care of that so that we get a clean slate, so that all the other diagnosis and treatment programs that we have will work very well. Another complex, what we call the lumbar pelvis hip complex, and a lot of times the patient comes in with low back pain, and we do a workup and they've got a low back problem. Yes, their subluxation is in their lumbar spine, but their sacroiliac joints are all injured and malpositioned. Their pubic symphysis is out of alignment, and they may have one or more hip sockets or both hip sockets misaligned. So we have to take care of all of these things, because the misalignment there is also associated with not only like sciatic pain and stiffness and spasm and low back pain and all these other things, but that is also an exit point for the parasympathetic nervous system. So if you have it up top and you have it down at the bottom, you really have it. Now also what we notice is that the pelvis is the base of support for the spine. So the spine sits on that. If the pelvis is not stable, the spine will never be stable. You'll never get anything to be adjusted and to hold. If you add the injury to the pelvis, low back pelvis hip complex, with the postural distortion from the upper cervical spine, you've got a pretty big mechanical problem, gravitational problem that's going on there that's really influencing the nervous system in a big way. So we want to take care of this complex down here in the pelvis, low back, hip sockets, because the misalignment there influences all the joints above and below on the kinetic pathway. The second to the last complex is the neck, shoulder, thoracic spine, rib cage complex, and that's where the patient comes in with a neck pain, and they say, I want you to look at my neck, and I need a neck treatment. And we look at it and we say, oh, well, you not only have a neck problem, but also you have associated shoulder, upper back, rib, and upper cervical spine subluxations. And we need to take care of all those things if we want to take care of your neck properly and to get it to heal and for that to get well. So the final subluxation complex is the global subluxation complex, and that's the total influence of all the joint subluxations on the entire physiology, but also on the brain and the mind. So what happens is the joints throughout your body have mechanoreceptors, and these are nerves that pick up, that sense the position of the joints within the joint capsules, whether they're lined up or they're misaligned. They pick up the orientation of the joint in space. These nerves sense the tension on the joint ligaments, tendons, muscles, the pressure within the joint capsule, and pain. Now, when you have subluxations throughout your body, these mechanoreceptors are all feeding that information to the brain, which is overwhelmed by all this. It doesn't know how to respond, in my opinion. It's overwhelming, and it causes a wearing down of physiological functioning and of mental functioning. So we want to clear out the global subluxation complex so the patient can heal and to begin to enjoy living their full potential. Now, if this profile appeals to you and you are a prospective patient, give us a call and set up for an initial evaluation or for a consultation. If you're a chiropractic student and you're interested in our field doctor extension faculty intern preceptorship program, give us a call and we'll talk to you about that. If you're a doctor of chiropractic and you would like to work with us as a consultant and to help you train for the system that we have, let us know. We also have associateships and ownership available here at our clinic as well. Now, if you're a prospective patient from a very long distance and it's not going to be possible for you to come here, you may consult with us. We can be your consultant. We can work with another chiropractor in your area and consult with you and that chiropractor and remotely take you through our diagnostic, analysis, and treatment program for the most part. So give us a call and we'll be happy to help you with that. Our phone number is 303-442-7772. Our web address is boulderchiropracticclinic.com, and our email is info@boulderchiropracticclinic.com. Thank you.